Imagine waking up one day, unable to remember the names of the people you love most. Imagine your memories slowly slipping away, one by one. Now imagine there's nothing you can do to stop it.
Imagine struggling with depression, experiencing sudden outbursts of anger, or making decisions that don't feel like the person you used to be. These aren't just mood changes. They could be signs of something much more serious. Now, imagine all of this begins years after you've retired from the sport you loved. Here's the frightening reality. Doctors still cannot definitively diagnose this disease while a person is alive. It's called Chronic Traumatic Encephalopathy, and it has become one of the most talked about brain diseases affecting athletes today. So, what exactly is chronic traumatic encephalopathy? It is a progressive brain disease linked to repeated blows to the head. Unlike a single concussion, this condition develops slowly after years of repeated impacts that damage the brain over time. Repeated head impacts can happen in many situations: football, boxing, hockey, rugby, mixed martial arts, soccer, and even military service involving blast exposure. Anyone with repeated head trauma may be at increased risk. Over time, repeated injuries may trigger the buildup of an abnormal protein called tau inside the brain. As tau accumulates, it damages brain cells, disrupts communication between neurons, and causes parts of the brain to gradually shrink. Researchers have identified chronic traumatic encephalopathy in the brains of many former athletes who participated in contact sports. Former football players, boxers, professional wrestlers, hockey players, and military veterans have all been diagnosed after death. These discoveries have sparked worldwide conversations about athlete safety and brain health. One of the most concerning things about this disease is that symptoms usually don't appear right away. In many cases, they don't develop until years or even decades after repeated head injuries have stopped. Early warning signs may include memory problems, difficulty concentrating, mood swings, depression, anxiety, and impulsive behavior. Because these symptoms develop gradually, they are often mistaken for other conditions. As the disease progresses, people may develop aggression, poor judgment, difficulty speaking, and eventually dementia. These symptoms can significantly affect everyday life and relationships. Many people believe that one concussion is enough to cause this disease, but current scientific evidence suggests that the greatest risk comes from repeated head impacts over many years, not just a single injury. Perhaps the most heartbreaking fact is this. Today, there is still no definitive test that can diagnose chronic traumatic encephalopathy in a living person. Researchers are working to develop reliable tests that could one day detect it much earlier. At the moment, there is no cure for chronic traumatic encephalopathy. Treatment focuses on managing symptoms, improving quality of life, and supporting patients and their families in the future. Around the world, scientists continue searching for therapies that may slow or even prevent the disease in the future. The good news is that protecting your brain starts with simple steps. Wear properly fitted protective equipment. Take every concussion seriously. Never return to play before receiving medical clearance. And always report symptoms instead of trying to push through them. Your brain is your body's most valuable organ. Whether you're a professional athlete, a student, or simply someone who enjoys sports, protecting it should always be a priority. If you or someone you know experiences changes in memory, mood, or behavior after repeated head injuries, don't ignore the warning signs. Seek medical evaluation as early as possible. If you found this video helpful, please like, subscribe, and turn on notifications for more evidence-based health content. What surprised you most about chronic traumatic encephalopathy? Share your thoughts in the comments below. Thank you for watching. Stay informed, stay safe, and I'll see you in the next video.